Hi, this is a quick video on a new PCMH requirement for when we see new patients. So if you see a new patient who is new to our practice, obviously, or a patient who has gone away, moved away, or not been back to our practice in several years, so is reestablishing care, in either of those two cases, we have to create a tracking entry for PCMH to show that we have essentially reviewed past medical history and determined a referral is not necessary. So the way you're going to do this is as follows. You're in the patient's chart. You're going to hit your plus sign. And here you're going to choose tracking entry. Okay. And then your name is up here. You don't have to worry about the flag date. You do not have to fill any of this in. You're just going to come down to reason for care transition. Click the book. When you click the book, you'll pull up PCMH tracking is going to appear here. You pick that, then you pick this phrase, click done. Okay, so this basically indicates, as we said, you've reviewed everything and you don't need to make a referral. Now, the other really important thing you need to do here is come down here and click that you have performed medication reconciliation, meaning you've updated the chart with whatever medications this child is on. Then you click save. And that is all you need to do. So this is going to be for any new patient to our practice or a patient who has been away for a while and is reestablishing care. Right. Thanks.